Hi everyone, and welcome to Health Me Please, the YouTube channel where you can find reliable and up-to-date information about diseases, treatment, and prevention. Today we will talk about coronary artery disease. Coronary artery disease is a serious condition that occurs when the arteries that supply blood to the heart become narrowed or blocked. It is a leading cause of chest discomfort and can be life-threatening if not properly treated. Emergency clinicians must be careful to avoid premature diagnosis of acute coronary syndrome, ACS, as chest discomfort can also be caused by other life-threatening conditions such as pulmonary embolism, aortic dissection, and pneumothorax. There are several risk factors for ACS, including a personal or family history of ACS or other cardiovascular disease, older age, diabetes, dyslipidemia, cigarette smoking, hypertension, and abuse of cocaine or other sympathomimetic drugs. The clinical presentation of ACS can vary, and characteristics such as the nature of the patient's chest discomfort and associated symptoms can help to increase or decrease the likelihood of ACS. Many patients with ACS present with symptoms such as dyspnea or malaise, either alone or in addition to chest pain. Patients who are older or have diabetes are more likely to present with dyspnea without chest pain. If ACS is the leading diagnosis, it is important to perform initial assessment and interventions rapidly. This includes performing a preliminary history and examination, attaching a cardiac monitor to the patient, giving oxygen as necessary, obtaining blood work, and administering aspirin. After initial assessment and management, the next steps in treatment depend on the type of reperfusion strategy chosen. For patients undergoing percutaneous coronary intervention, PCI, assessment and treatment related to the PCI procedure are necessary. For patients undergoing fibrinolysis, the goal is to safely administer fibrinolytics as soon as possible. In patients with ST elevation myocardial infarction, STEMI, who will not undergo reperfusion due to contraindications or lack of access to reperfusion therapy, acute management consists of continued monitoring and medical therapy for STEMI. During the first 12 months after an ACS event, it is important to continue with appropriate medical therapy. This may include the use of oral anticoagulation plus a P2Y12 inhibitor plus aspirin, with the duration of aspirin therapy determined by the patient's thrombotic and bleeding risks. For most patients, a direct-acting oral anticoagulant is recommended rather than warfarin. For patients who have undergone PCI with stenting, either clopidogrel or ticagrelor is a reasonable choice, with clopidogrel being used for patients. Thanks for watching. If you want to stay up to date with all of our latest videos, make sure to hit that subscribe button and turn on notifications so you never miss an update. Finally, we want to remind you that the information we provide on this channel is for educational purposes only. If you have any symptoms that you suspect may be related to a particular disease, it's important to see your doctor as soon as possible.